I'd like to now return to the Vatican's WASH in Healthcare Facilities Initiative, which has been instrumental in convening and advancing this work. This initiative has developed a model which deploys networks within the Catholic Church to address this problem at scale. Our program for this first day will focus on Catholic leadership in general, including both the Vatican Initiative, but also other Catholic agencies and entities who are working together to advance WASH in healthcare facilities. Tomorrow, our presentation and discussions will focus more on what other religious institutions, faith-based organizations, and secular and public sector organizations are doing, as well as on the resources that will be available to support ongoing work. So today is all Catholic all the time, and tomorrow focuses on other faith-based resources as well. We now have the opportunity to hear directly from the dicastery about this initiative and for the reasons behind their leadership and commitment to this issue. It's my distinct honor to introduce Dr. Tebaldo Vinciguerra, who is an official of the dicastery for promoting integral human development and who will kindly chair this session and guide us through the important initiative. As he comes to the dais, I can say that we had a wonderful meeting at the dicastery yesterday, chaired by Dr. Tebaldo, in which, among other things, he explained to his colleagues that this is what he had been doing for the last 5 years, with weekly, sometimes more frequent meetings. So thank you so much, Dr. Tebaldo, for your leadership and for your chairing now.
Thank you. Thank you very much, dear Jean. Again, dear friends, dear colleagues, good morning. It is a pleasure, a privilege, a honor to be here in real life after 5, 6, occasionally 7 years with some of you working in small little squares all over my screen. It's wonderful to see this synergy and to meeting many other colleagues and organizations sharing the same concern, sharing similar expertise. I have the pleasure to call Sister Alessandra Smerilli and Dr. Tony Castleman. Please here. The two of you will be together with me in this panel. Thank you very much for joining. Having with me a member of a religious congregation, so a religious sister, and a representative from a Caritas member organization gives me the chance, the occasion, I shall say, is to express my gratitude, my deep admiration to all the religious congregations, so male and female religious orders, as well as all the members of the Caritas Confederation, which have been supportive, committed, sharing their problems, their hope, their solutions during all these years, working with friars, sisters, and all your advocacy, technical staff, some of them are in the room, has been really so enriching, so inspiring. Being, let's say, simply behind a desk, a computer in the dicastery, has this privilege. You are a generalist, but you are in contact with fascinating people all over the world on the ground. Sister Alessandra Smerilli already introduced herself as a Salesian sister. For those who are not familiar with Catholic culture, we tend to see Salesians, brothers and sisters, as very much committed towards education and youth. She's a professor of political economy, so she taught economics and ethics. She has been supporting in several ways the Italian bishops as well as the Vatican state itself. She joined the dicastery in 2020 and became our undersecretary and later our secretary, appointed by Pope Francis. Dear sister, please, you have the floor and for your remarks.
Thank you very much. And again, good morning to everyone and welcome to Rome. I'm very happy to welcome you here, and I bring you the greetings of Cardinal Michael Czerny, our prefect, and the Dicastery for Promoting Integral Human Development. But above all, I thank you personally for being here. When you look at this room and why we were presenting ourselves, introducing ourselves, I mean, it was impressive. I was in chat with the Cardinal Michael Czerny, and I wrote, I'm impressed. And he said, I was impressed as well yesterday when I met a small group in the corridors. So I think the energy we feel in this room it's a very good sign, and I hope this can become action and can be fruitful. So you have come from different countries, different traditions, different professional worlds. Yet, what brings us together is very simple: care. Care for people, care for life, care for dignity. I don't know how familiar you are with the work of a Canadian philosopher, Jennifer Nedelsky, and she is working on care, and she dreams a society based on care, because she says that care is forgotten, and the reason why care is relegated to the private life and families, and it's not socially valued, is because traditionally it was entrusted mostly to women. And she say a dream, a world in which when we meet a person for the first time, after introducing ourselves and asking the name, who you are, usually the second question is, what do you do? And she says, I'm dreaming a world in which the second question is, who do you take care, whom do you take care for? And maybe in the next round of the introduction, we can, or during the break, we can introduce ourselves saying, I take care of. Much of the work you do in WASH is never seen, rarely celebrated, but it makes all the difference for patients, families, nurses, doctors, cleaners, maintenance workers. For them and with them, thank you. We are meeting in Rome, a city where history reminds us of something important. Not far from here, on the Tiber Island, and I know we have representative from that place, I mean, you find a church and a hospital standing side by side. This is not accidental. From the beginning, faith and care for the sick have worked together. When one is missing, something essential is lost. As a religious sister, I've learned that healthcare is not just a service we provide. It is one of the ways the gospel takes flesh. Pope Francis, and yesterday was the first anniversary, repeated many times that the church is called to everyone, yes, but first to the poor, the sick, those who are forgotten, those who have no voice. This is not a strategy, it is a choice of love. And in the exhortation Dilexit Te, Pope Leo wrote on love for poor persons and about the unique role that care for the sick plays in the church. I'm quoting, "Christian compassion has manifested itself in a particular way in the care of the sick and suffering. Based on the signs present in Jesus' public ministry, the healing of the blind, lepers, and paralytics, the Church understands that caring for the sick, in whom she readily recognizes the crucified Lord, is an important part of her mission. For this reason, how we care matters, and this is why WASH matters. Water, sanitation, hygiene, these are not secondary issues. They are not technical details. Without them, care is incomplete. Healing becomes fragile. Dignity is compromised. Pope Francis called access to safe water a basic human right and spoke of the debt owed to the poor when this right is denied. But he also said something very important. This is not only a technical problem, it is a cultural one. It asks us to change the way we think. You know the reality very well. Many healthcare facilities serve communities at the very margins, what we call the last mile. Often in places where governance is weak, resources are scarce, and insecurity is part of daily life. Many religious congregations and local churches try to do more with less, while traditional sources of support are shrinking. At the same time, we see resources moving elsewhere, away from development and care. And we know that, needless to say, what we are seeing during these days all around us. As many of you know, a few years ago, our dicastery promoted a survey of WASH conditions in a sample of healthcare facilities inspired by and related to the Catholic Church, spread over 23 countries. Let me take this occasion to acknowledge those who made this survey possible through your financial, organizational, and technical support. Thank you, in particular, to the Caritas Confederation and to the team put together by Global Water 2020. I also would like to acknowledge the availability of the church representatives at local level, bishops, Caritas agents, sisters and brothers, doctors and nurses, who decided to contact the dicastery and to join this initiative, accepting to be evaluated through that long and detailed assessment without the certainty that financial support would follow. You know, it sometimes takes a bit of courage to say, here things are not going that well, our procedures may be inadequate, we are willing to be included in a survey and to appoint someone for that. The first results were released in 2021 and a more detailed study published in 2025. We received those sobering results with respect and profound compassion. Usually in our dicastery we say we are not interested in numbers, we are interested in people. Each one is counts for us. And for this reason, our regional coordinators, they are asked to be in contact almost daily with local churches and to understand what's happening in the ground, where there is the real life, because we can read statistics, and they are important, but numbers, they do not give a precise account of what precisely is going on. Of course, we knew that the situation in same areas, including the majority of the dioceses covered by the survey, would be unsatisfactory and suboptimal. Still, no such prior exercise has systematically analyzed and measured this situation with a sample of institutions related to the Catholic Church, nor are publicly shared such findings. This facilitated the reflection about possible next steps. And we know the conclusion: we cannot continue like this. And as Cardinal Czerny said very plainly, without WASH, healthcare cannot be healthy. And I would add, without collaboration, will not move forward. Too often, facilities struggle alone. Yet, what is impossible for one can be possible when we share knowledge, resources, and responsibilities. And this room is promising from this point of view. Sometimes the problem is not just money, it's mentality. During a dialogue with local church agents, they say, we never ask donors to support toilet or sewage maintenance. When toilets broke, we closed them until only one barely functioned and the damage spread to the building. Over time, everything deteriorates. The same logic appears when donors can fund buildings but not maintenance. These are just small examples, but they reveal something deeper. We need a conversion of mindset. This also requires advocacy. Governments and institutions must recognize that WASH in healthcare and in schools is not optional, is foundational. Much can be done. Some steps are small and local. Some actions represent low-hanging fruits and hopefully can be achieved at local level easily and soon. Other issues require long-term commitment and a global alliance which work in synergy. This is precisely the purpose of this gathering. Therefore, again, thank you for being here, and I pray for fruitful discussion during these 2 days. The Dicastery for Promoting Integral Human Development is committed to working with you to assist health facilities throughout the world in ensuring that patients and health workers have safe water, sanitation, and hygiene. I look forward to learning about the results of our discussion and proposed next steps. We are hosted by the Jesuit Curia, and I know there are numerous Catholic organizations gathering here, Catholic, not Catholic. This is an ecumenical effort and an effort to put together faith-based and all people of goodwill. And I rejoice for the presence of brothers and sisters from many Christian denominations. I also rejoice for the presence of representatives of major Muslim organizations. There certainly is ample room for interreligious collaboration in this field, thus advancing mutual understanding, solidarity, and peace. Finally, I'm grateful for the presence of representatives from technical organizations, development agencies, and international organizations. Your presence can be a strong signal of respectful collaboration between technical, development, and multilateral actors and faith-inspired organizations. Only together we can achieve something, because being experts without knowing the reality can be very dangerous. But knowing the reality without the expertise can be dangerous as well, or ineffective. And so we need this alliance, and we are grateful because you are willing to work together, to listen to each other, to have conversations, and finally to put everything into action. And so thank you again, and may God bless us and protect us and bless your work, what you are doing, and hopefully we can meet again with more achievement and things already done when we see next time. And before I close, I'd like to say that I'm very sorry because an intensive week at the dicastery have been scheduled a long time ago, and it will start tomorrow morning with people coming from abroad, and so we can't attend the meeting tomorrow, but we are eager to listen to what is going to happen and to the results. And we'll be here with our hearts offering the Mass tomorrow morning for this meeting as well. And thank you, and God bless you.
Thank you very much, dear sister, for your remarks, for this wonderful, wide framework you offer to our day on WASH in healthcare facilities. Greetings again from those who are following us online. After the remarks from Sister Alessandra, Secretary of the Dicastery for Integral Human Development, I will now call Tony Castleman from Catholic Relief Services, with whom I had the pleasure to work for many, many years. Tony, you've been working with Catholic Relief Services for the past 12 years. In the past, you have been the Director of Programs focusing on water, livelihood, and environment. Now you are the Director of the Program Impact and Quality Assurance Department. You have a PhD in economics, and you have expertise in several development organizations, NGOs, and multilateral donors. Dear Tony, please, you have the floor.
Thank you, Tebaldo. And thank you, Sister Alessandra, for your encouragement and your inspiring words, and for reminding us of the importance of care, which is at the center of all of this work. And thanks to the dicastery for your leadership and the voice that the dicastery for promoting integral human development has provided and continues to provide to this initiative that ensures water, sanitation, and hygiene at healthcare facilities. There are many different entities within the global church that serve vulnerable people around the world and work to contribute to the common good. What stands out to me about this initiative is something you referred to, Sister Alessandra. It's the power of partnerships, where various entities are working together in complementary ways toward the common goal of improving WASH in health facilities. There are sisters congregations, dioceses, Catholic health departments, Catholic health commissions, Caritas organizations and other implementing groups, Catholic donors, universities, and other members of the global church that we'll be hearing from today. This type of unified collaboration is possible thanks to the convening power of the dicastery and your moral authority in articulating the need and the compelling nature of this issue. And through this collaboration under your patronage, our collective effectiveness and impact has become greater than just the sum of the individual entities, because each group is offering what it does best. We heard this morning from Jean about the numbers of Catholic health facilities where WASH has been improved through this initiative, each facility benefiting thousands of patients. As you said, we need to think about this in terms of people, not just in terms of numbers. And in addition to that direct impact, this work is serving as a model for a much larger number of facilities in Catholic health systems, as we'll be hearing about later today. And it's serving as an example and an opportunity for sharing and exchange with other faith-based facilities, as we'll talk about tomorrow. And beyond faith-based facilities, it's contributing to national health systems and national goals. So for those of us working in this area, the dicastery's commitment to this work has been truly gratifying, starting with Cardinal Turkson's outreach to every country's bishops' conference to improve WASH in Catholic facilities in their countries, continuing with Cardinal Czerny's support and his articulate public statements and published interviews highlighting this work. And Sister Alessandra, we are grateful for your leadership and commitment to these continued efforts and for offering the dicastery's patronage for this gathering and for addressing us and sharing your thoughtful remarks today. And we are grateful for sharing Tebaldo, who has been a fantastic partner in this initiative and whose guidance and grace and wit have been instrumental to this initiative. Lastly, I just want to appreciate how having this work under the auspices of the dicastery reminds us of the important roles that dialogue and subsidiarity and dignity play in these activities. The dicastery's initial outreach to Episcopal conferences led dioceses to identify specific health facilities where WASH needed to be improved. It was the diocese and bishops' priorities that determined the facilities this initiative focused on. And while groups like ours and others have provided technical and financial support, the activities were led and sustained by local teams of sisters, healthcare workers, facility supervisors, and engineers. This work has very much been dialogue and subsidiarity in practice. And finally, dignity, and I should say dignity and care, because I really appreciate the reminder of the role care plays in this. Human dignity stands at the center of integral human development, and I think all of us in this room believe in the inherent dignity of every human being. For many of us, upholding human dignity is a prime reason why we work in this field. And what issue supports people's dignity more than this one? Than ensuring that patients have basic clean water and sanitation facilities when they visit health centers. That mothers giving birth have private and sanitary places to wash. That families coming miles for health care have safe water, functioning toilets, and don't need to worry about catching a secondary infection due to poor hygiene at the health center. And not only patients, but as you reminded us, Sister Alessandra, healthcare workers and cleaners and other facility staff whose safety and workplace dignity depend on adequate wash. The dicastery's leadership of this effort has helped keep these values of subsidiarity and dignity front and center. So on behalf of CRS and all of the groups involved in this effort, I extend our gratitude to the dicastery, and we look forward to continuing this inspiring and impactful collaboration. Thank you.
Thank you very much, dear Tony, for this beautiful and really motivational response to Sister Alessandra's remarks. The two of you insisted on care, partnership, and dignity. So I think these are the three key words I can collect after those two interventions, and I'm now happy to pass the controls again to our Master of Ceremony.
Oh yes, complete control. What a wonderful introduction. Thank you so much, Sister Alessandra, for the reminder of grounding us in care. And I definitely want to look up that Canadian philosopher. We'll need to get Jennifer Nadesky, her name. And while you were here, Sister Alessandra, I don't think that we really made enough note of Tebaldo's key role in all of this. And so I would like, on behalf of the organizing team, to appreciate, he'll be very annoyed, to appreciate his faithful service to our team and his diplomatic and firm guidance and suggestions and his steadfast commitment to this mission, which has really made our collective work possible. So, Tebaldo, we really appreciate you. Thank you so much. Thank you.
It is a partnership. Thank you.
Conferences never run like this. Sessions never end early. But what we're going to do, now that we have had this wonderful introduction, and now that we have mostly, there are a few people who haven't yet been able to introduce themselves, but now that we have begun the introductions to each other, is what we will do now is actually